to Molyneux to catch the bus to go to school, the convent high school. Thank you very much for your warm words of introduction this afternoon. And so this afternoon, I want to speak to you about the process of testing for COVID-19 and the process of making a diagnosis of COVID-19. So who can be tested for COVID-19 and what tests are used? Suspected cases with respiratory tract symptoms and significant contacts of persons who have been confirmed with COVID-19 but who may not have symptoms. So in other words, individuals who are suspected of having COVID-19, these are the persons who are being tested, and contacts of confirmed cases are also considered for testing. So now, how are the tests done? Now, there are two ways of testing. One, by using the gold standard, or what we call the RT-PCR test. And the second is the COVID-19 rapid antibody tests. Now, the gold standard is the test looking for the virus in the person's airways. This is done by taking a swab from the nose and mouth or throat and then testing it utilizing the RT-PCR methodology. Simply put, the test detects the virus as it multiplies in the nose or throat. The COVID-19 rapid antibody tests, these test kits identify the presence of antibodies in the blood. These antibodies are really proteins produced by the immune system to fight off infections. So the test picks up these proteins or antibodies. There are two types of antibodies being produced, the IgM and the IgG antibodies. The IgM antibody is developed or produced over 1 week after symptoms and indicate acute infection. The IgG antibodies appear weeks later and indicate immunity. These tests have a low sensitivity. However, they are still being developed, although a number have appeared on the market. Earlier today, the World Health Organization issued a release warning against the use of COVID-19 rapid antibody test kits at this time. We had cautiously begun to look at some of these test kits, but always with the confirmatory result of the gold standard RT-PCR test. However, going forward, the Ministry of Health will heed the warning of the World Health Organization. At present, the Ministry of Health utilizes two laboratories, the Caribbean Public Health Agency Laboratory in Trinidad and the Next Generation Laboratory located here in Bastia, St. Kitts. Samples from persons with symptoms or symptomatic patients are sent to the Caribbean Public Health Lab in Trinidad for processing. As said before, CARPHA does not process samples from asymptomatic contacts of COVID-19 patients. In other words, CARPHA does not process samples from patients who are contacts of COVID-19 who do not have symptoms. These asymptomatic contacts are processed at the NextGen lab locally. Because the list of contacts is significantly longer than the list of suspected cases, it has created a large volume of samples to be processed at the Next Generation lab. This can add to the waiting time for results, as the lab's capacity could be stretched if, for example, one symptomatic patient can have as many as 20 or more contacts. Sometimes one may need to retest a patient the same way one can be called back to have a routine blood test repeated if the sample was deemed not adequate. A person can also be retested if there is a change in their clinical status or to determine their progress. One person could have unknowingly had more than one potential exposure in time and may need to be retested. Retesting is therefore a critical part of the process of diagnosing COVID-19. I repeat, retesting is therefore a critical part of the process of diagnosing COVID-19. And so retesting is not unusual in the clinical setting. Testing is not unusual in the clinical setting. And the Ministry of Health continues to test. Testing is a priority for the Ministry of Health. And there was another question being asked, were samples lost or misplaced? I want to state emphatically that we have not lost or misplaced any samples. I want to end on a positive note, and that is St. Kitts and Nevis enjoys one of the highest rates of testing per capita in the Eastern Caribbean and amongst CARICOM member states. Thank you.